Whenever everybody's ready, we can get started.
Good afternoon, Commissioner. I'm Zach Telerik, the Director of the Office of Management and Budget. Our next budget hearing is from the Franklin County Office on Aging. Tony Carroll, the Director, will introduce the others at the table for the presentation.
Great.
Good afternoon.
Good afternoon.
Very pleased to be here to talk about what we do. You know, I love talking about what we do. On my left is Barbara Sullivan. She's the manager for our Senior Options Program, which, as you know, is a big part of what we do. And on my right is Amy Funk, who has laryngitis, and she is our manager of finance and operations. So if you have questions, she's going to hold up signs. She's having trouble talking today.
Oh.
We have 6 programs in the Office on Aging, and what I'd like to do is talk briefly about each of those 6 and what our goals are for 2017. They should be very familiar to you. We've had a very stable set of programs for many years. But the key goal for us in 2017 is our Senior Services Levy. Our current levy will expire at the end of 2017, so one of the important things we need to accomplish in 2017 is getting a new levy passed.
Mm-hmm.
The services and programs that Senior Options provides are critical to the health of what is a growing older adult population in our county. We've been working this year closely with OMB and the Human Services Levy Review Committee for a ballot initiative, which we hope will be on in 2017, because without a new initiative, everything we've been doing all this time would not go forward. So 2017 will be a challenging year for us. Our largest program, and the program that really is the budget driver for us, is home and community-based care. As the older adult population increases, this particular program is going to continue to be challenged to meet the needs of a growing population. I just picked out a couple of the services where we've done a lot of activity in the last 12-month period. During the 12 months ending October 31st, for instance, we provided almost 650,000 home-delivered meals and over 2,100,000 miles of transportation. And that doesn't really count the transportation that goes on in our grantee program, the small group transportation, if you recall that, for instance, that CRC does. So we provide an awful lot of transportation.
A lot.
And that continues.
But I think that goes to show what a great need it is in this community. Transportation, I think, is the biggest need next to housing that we have in the community. People needing transportation to get to appointments, to get to work. Well, you don't provide work, but to get to doctor appointments, to get to appointments, to get other things done that they need. It's really important, and it's a need. Yeah.
It's significant nationally, particularly for older adults.
I know.
It is always at the top of the list when you talk about unmet need. It's a way to break up isolation. It's the way to get your health care. It's the way to get your groceries done.
Oh,
so
I know.
it's but that always sets me back a little bit, over 2 million miles of transportation.
Wow.
But the others that are part of this program are things that you're probably familiar with too, as well as adult day health, caregiver relief, the emergency response buttons, these kinds of services. So this program really is our budget driver. We anticipate at least a 4% increase in enrollment in this program in 2017, and we plan to maintain our customer satisfaction at 90% or above. And usually it's above 90%, but that's what our goal is for 2017. And we're always pleased when our goals align with the commissioner goals. So we feel that this one aligns very strongly with your goal to provide supportive health and human services to community residents. Another important program is our customer services management program. One of the things we're going to be sure to do in 2017 is continue to maintain the standards that have allowed us to be accredited for information and referral. I think we're still the only accredited aging specialty for information and referral in the state of Ohio, as far as I know. Barb stays on top of that. So we'll continue to work around those accreditation standards so we can keep that. This is actually the service that we offer to the largest number of people in the community, because we, when our phone lines open at 9 a.m. every morning, people have questions, and many folks can make their own plans for long-term care if they have the information to get themselves started on the right direction. So we offer, and we're pleased to offer, a lot of information or referral in the community. But in addition to that, the folks that are enrolled in our home and community-based care program each have a trained case manager that helps them with their services and with their clinical needs. And again, we would anticipate next year that we would maintain at least a 90% level of customer satisfaction with the case management services that our clients receive. And again, this aligns with your goal of wanting to be providing quality customer service to the community. Community support, outreach, and specialized services is a really nice program that links us with lots of other agencies. We've included for your review a chart that outlines all of our community partners in this area, so you can take a look at that and know who we're working and playing well with together. Mm-hmm. One of the things that we are very pleased to be doing this year, and we'll be doing more of next year, is working with the Age Friendly Columbus Initiative. Mm-hmm. We are participating, I mean key staff at the Office on Aging, participating in work groups around things such as healthcare, transportation, and housing. And the Age Friendly staff members have done a community survey, trying again to find out what community needs are, and they are anticipate releasing that in January of 2017. Mm-hmm. And MORPC is the lead agency for that, and they're doing a great job. Because as you know, in my heart, I want it to be age-friendly Columbus, age-friendly Franklin County,
right,
age-friendly region.
So does MORPC.
Right, exactly. So they're a perfect partner to be working with us on this project. Yeah. We do have partnerships with a really fine group of agencies, and you can see them on your chart and how much funding they were allocated in 2016, and then we'll do a new chart when we get everything together for 2017. So our goal here is to have make sure that at least 90%, and again it's usually more than that, of our grantee agencies adhering to their performance targets. We have performance targets for each of these agencies, and we monitor how they meet those goals. So this is one of the commissioner principles, developing collaborative partnerships to improve service delivery. Within this program, we do have a couple of new initiatives this year. The first one is with Catholic Social Services Foster Grandparent Program. They have recently been chosen the new administrator for our local foster grandparent program. And if you don't know about foster grandparents, it's similar to senior companions in that the volunteers are all low-income older adults who receive a small stipend and transportation reimbursement, as well as training and a few other benefits to provide volunteer services. In Senior Companions, they're providing these services to other older adults. And the nice thing about this foster grandparent program is they are going to be providing these services to youngsters who need assistance with various and sundry literacy activities, other kinds of activities in the schools. So it's really,
it's a
really
great
neat
program.
And it's going to be,
They've just
it's really
taken
good.
it on, and
Yeah.
it's a really great
Right.
program.
Right.
I'm so glad you're working with them.
And it, again, I don't know if one day last week there was an article in the Dispatch about isolation and
Oh,
with
it's
older
a
adults.
terrible issue.
And this is the kind of thing which gives a low-income older person who might not otherwise have an opportunity to be able to volunteer, to have a purpose. It's really nifty. They're going to be working with Columbus Public Schools, YMCA Head Start, Diocese of Columbus, and Boys and Girls Clubs of Columbus at least, and they may add other partners as time goes by. So they are also developing performance measures and are going to very strongly work with all of their partners to be sure that the performance targets get met. So we're really excited about
That's
this
great.
new partnership. We're also in conversation, we haven't put everything together yet, with the Mid-Ohio Food Bank. They've been a partner of ours for a while, serving basically the senior high-rises, and they have brought to us the recommendation that we look at some expansion into neighborhoods where they have identified high numbers of seniors that they could bring some of those services to in a neighborhood setting, not just in a high-rise setting. So we're excited about that, and we anticipate we'll be doing a little bit more with them next year. And again, that's an expansion of existing partnership, but it's an important collaboration for us. Safe Housing is our minor home repair program, and we would aim to complete 90% of the repairs within established timelines. These can be a little, sometimes there's some challenges in meeting this goal. Folks can go into the hospital, the weather can get bad, but basically we come pretty close to the 90% most of the time. We don't oftentimes get into the high 90s again because of difficulties with getting repairs done, but we try to make sure we get at least 90% of them done within time standards. And this is our big collaboration with the Veteran Service Commission, and we've been doing this for many years. They've been easy to work with, and it's really very efficient. It has avoided duplication of effort, and seniors are getting the home repairs done that they need. So we also can do this through our partnership with them for folks under the age of 60. They just have to pay the administrative cost, so that we're not using levy dollars for people under 60, but we can still get the work done for them. It works out really nicely.
Oh, great.
They just pay us for it.
Oh,
So that's good. So we also have a similar arrangement with the emergency response buttons, which they are identifying folks at their end who need those devices, and rather than they're having to do
That's the
contracts.
thing that you wear
Right.
around your neck?
I've fallen and I can't get up.
Yeah.
Yeah, but those are very important for people.
Oh, I know.
Very, very important
My
for
mother
people.
has one.
Very important. So we're excited about that partnership. Protective Interventions is our adult protective services program that we do under contract with Job and Family Services. We investigate allegations of abuse, neglect, and exploitation of folks 60 and over. And there are time standards developed in the Ohio Revised Code, and our goal is to continue this work and within the time standards that ORC requires. And this is the Commissioner's principle around community safety. So our last program is our public information, which is our effort to make sure that our community members are informed about services and programs that are available. It's similar to what I heard Veteran Service Commission talk about, people not knowing where to go and what to do. And so we can't say call 525-6200 too many times, because we do have a one-stop shop, and if someone called us with a veteran, which happens often, calls us with an issue related to veterans, Barb and her folks will get them off to either the Veteran Service Commission or the VA.
Mm-hmm.
So it's very important to have information out there that's accessible that people can utilize, so they know who to call. Because you don't oftentimes have that in your head until mom takes that header down the steps
Oh, yeah.
going to
Sure.
get to the laundry in the basement, and then it's like, oh my Lord, what do we do? And so try to get that information out there as much as possible in a variety of mediums. So we always have increased requests for information, and we again try to maintain at least a 90% level of satisfaction with the information provided. Again, this aligns with your principle of high quality customer service. So these are our 6 programs that are part of our strategic business plan. We're going to have challenges in 2017. We'll have more people needing service and coming to the end of a levy cycle. But we've got great staff. We've always been very pleased to get strong support from the Board of Commissioners. So we think we're going to be positioned well for going forward 2018 to 2022.
You do such an important service for so many people in our community, and more people, as you say, will be needing the services that you provide. So, we just got to get to work.
That's
Lots of good staff, lots of good people that volunteer with the Senior Service Roundtable.
exactly.
You're going to have to leverage all of that and just get the work done for our residents. And I'm so glad you're working on that age-friendly community.
I think it's going to be exciting.
Mm-hmm. That's great. Thank you.
Any questions for us?
I
I figured that you knew what we were up, you knew what we were up to.
I do, and yet, I could ask a million, but not right now. I'm good.
Thank you.
Thank you.
Anybody
And
else?
thank both of you, and I hope you get your voice back.
I'm glad she didn't have to hold up any signs.
Just smile. Thank you.
Thank you.